Hi there. What's the first thing that comes to your mind when you hear the word fever? If you're from Nigeria, Africa, where I come from, perhaps malaria comes to your mind as the first thing, or maybe even typhoid, right? Okay, so I'm going to be talking to you about fever, especially in children, what the concerns are, what not to do, and what to do when there's a fever. Now, just to clear the air on this, a fever basically is when the body temperature is elevated above the normal range. Usually temperatures above 37.5 degrees centigrade is considered a fever. And often as it is said that there is no smoke without fire, what a fever is actually is smoke. That means that when there is a fever, that means there's a fire burning somewhere. That means something is going on in the body, and the body's response is to raise the temperature. Now, while fever is part of the body's defense mechanism against germs, it can have harmful effects, especially in children. The high level of temperature, especially in children under the age of 5, there's a risk of convulsions in some children, especially boys. And then basically when there's a fever, everything is burning up. And then there's the general discomfort that comes with having a fever. So what shouldn't I do when I have a fever, or when I have a child around me that has a fever? Well, the first thing not to do is to jump to the conclusion that it's malaria or an infection and rush to a nearby pharmacy, get an anti-malarial and an antibiotic to use. No, that's not the first thing to do. The first thing you can do right at home is what we call tepid sponging. You can put a towel in lukewarm water, squeeze to let out some of the water, leaving the towel still a bit wet, and then mop the body. Alternatively, you can take a shower with lukewarm water as well. Ensure you do not use cold water. If the water is too cold, the tendency is that the temperature would crash and jump right back up in a little bit. Another thing you can do is give over-the-counter antipyretics such as paracetamol, which is usually readily available. It helps to bring the temperature down. Now, those are the first steps. Following after that, what should you do? Since we have agreed that a fever is smoke, and then there's fire causing the smoke, then it's important to identify what the fire is, where the fire is, and to deal with it. And that would imply that the next right step to take when there's a fever, especially in a child, is to take the child to the hospital. You do not use paracetamol for 1 day, 2 days, 3 days and say, well, I was watching to see what was going to happen. There is a reason why this child, why this person is having a fever. And what you should do is get to the nearest hospital, healthcare center, and have the child or the person assessed to find out what exactly is the cause of the fever and to treat it appropriately. So, quick recap: the fever, temperature above 37.5. Fever is not good for anyone. There's the feeling of it is not good, and as much as it is part of the body's immune defense system, it has its own deleterious effects. Tepid sponge, give paracetamol. Those are the first steps. Subsequently, please get to the nearest available health center, get checked out. Let's find out exactly what the problem is and treat appropriately. Now, a quick one about typhoid fever. There's a tendency to think when you have a fever that if it's not malaria, then it's typhoid fever, and it's common in people to come with this diagnosis of malaria and typhoid made based on certain lab tests or in certain hospitals, or just the guesswork by anyone who feels, well, I've treated malaria and I'm not better, so it must be typhoid. It's important to clear first and foremost that malaria and typhoid are two totally unrelated illnesses, though certain symptoms might overlap, but they are not brothers and sisters. Malaria is caused by Plasmodium species, which is transmitted by the bite of a female Anopheles mosquito. Typhoid, on the other hand, is caused by Salmonella typhi, which is a bacteria which is transmitted by what we call the fecal-oral route, meaning that usually your food or drink has to be contaminated by the feces, more or less, of someone who is carrying the bacteria. Hence, the disease was very common when people used to drink from flowing streams and the likes, where people would have passed their excreta and all. And now with proper hand hygiene and all that, the chances are much less. In many places, developed areas, there's a tendency that food handlers you need to go through certain tests to ensure that they are not shedding the bacteria. Now, this doesn't mean it's impossible to come down with typhoid fever. However, it's important to note that typhoid is a very serious illness. It's not the kind of illness that you just feel sick and you're at home and you're self-medicating. No, it's very severe, usually headache, splitting, temperature, hitting the roof, could be associated with diarrhea, terrible abdominal pain. It's a very serious illness, and most people who come down with this illness end up hospitalized. Hence, it's not something that you just make a quick diagnosis and then jump at an antibiotic, especially Cipro, fluoxetine in my part of the world, to use. Also, it's important to note that the common test that people use to reach this conclusion, the Widal test, is largely an outdated test. Previously, even when it was in proper use, it used to be based on rising titers. So the test is done today, it's at certain levels, and then it's done again at a certain interval, and it's even higher. But now a lot of times people just go, they do a spot test and come down with a result, and the conclusion is that there is a small typhoid, which of course there is no such interpretation. Also, the test is operator dependent. It depends on who is carrying out the test, will determine what the interpretation of the test is. Hence, it's important to know, if you have a fever, please use antipyretics like paracetamol and then get to the nearest hospital and get properly tested. Malaria should not be treated except it's confirmed that it's malaria, and we shouldn't be talking about typhoid fever except it is confirmed. And the only way to confirm for certain right now, the golden test, is to do a blood culture, which takes a few days to be available. However, there are other things aside symptomatology that can be used to determine that this could be typhoid fever. So please do not relate malaria with typhoid. There's nothing like small typhoid. Typhoid is a very serious illness. You're ill with a fever, get to the nearest hospital, get checked out. What are the dangers of self-medication? It's easy, particularly in my part of the world, to walk into a pharmacy and get several kinds of medications that in some countries are not considered over-the-counter medications. Ideally, you should just be able to get a paracetamol, maybe an antihistamine, and things of that sort without prescriptions. But in some cases, in some countries like mine, it's possible to walk into a pharmacy and get an anti-malarial, get an antibiotic, and maybe even more. But what are the dangers associated with you just going ahead and treating as you deem fit? Well, when it comes to antimalarials, antibiotics, there is the place of resistance developing to the germs that are causing whatever is going on. Now, it's been agreed that malaria should not be treated except a test confirms that there is actually malaria. The reason why we've come to a point where we have combination antimalarials such as artemether lumefantrine, which in my part of the world many people know by the names Coartem, Lonart, Lumatem, and the likes, is because over time the abuse of antimalarials have led to a point where the bugs have over time developed resistance to the common antimalarials. So it's important that first and foremost there is a confirmation that this person has malaria, and then the antimalarial, a combination drug, is used properly. Same applies to antibiotics. When they are used indiscriminately, the tendency is that whatever bug is there, adapt. Just like human beings, we adapt to situations around us. Bugs too learn to adapt, develop mechanisms to ensure that these antibiotics fail. Now, if you've abused antibiotics, use them when you don't need them, use them in the improper doses. The tendency is that when you do need antibiotics, they might not work for you. So you feel ill, you have a fever, please, difficult as it may seem, approach the nearest healthcare center to you, interact with a doctor, a medical personnel, and get proper testing and proper treatment. Hi there. Let's talk about herbal concoctions, commonly referred to by the Yoruba people as agbo. For a number of you listening to me, it's possible that you were raised by parents who used to give you these herbal concoctions growing up to take care of different illness states. And many of our parents, many of our grandparents, if you're from my part of the world, if you're Yoruba, believe very strongly in these herbal concoctions, and for different reasons. Some really justify it. What's the issue with herbal concoctions? Is this a conversation to speak against herbal concoctions? Not necessarily. It's basically to educate us about the use of herbal concoctions and in comparison to orthodox medicine, and to see which might be safer and for what reasons. There is a lot of trust in these herbal concoctions as being from natural products, and in actual fact, current day pharmaceutics is to a large extent based on the study of these plants and roots to find out what's in them, how they get the effects that they are known for. Now, in orthodox medicine, your tablets, your syrups, all these drugs are a product of research. And many, like I said earlier, are based on these natural roots and leaves and barks. And so what the scientist does is to take these leaves, to take these roots, often based on pre-existing information that these leaves, these roots actually achieve so cure or that cure. And then they take these leaves and roots and then subject them to testing. In subjecting them to testing, what they do is try to find out what these leaves contain, what these roots contain. Permit me to use an example. Let's say leaf A contains 3 items by the time they separate it in the lab. Items A, items B, and item C. And leaves, is known to be used in the treatment of malaria, for example. What the scientist does is to sit down and say, what is A, what is B, what is C, what effect does A achieve, what effect does B achieve, what effect does C achieve. So as touching malaria, for example, does A cure malaria? If they find out that, A seems to have an effect in treating malaria, they now take a further step and say, how much of A is enough to achieve this effect? How much is too much that may be harmful to the body? How much is too little? Then they can take a look at B and say, does B have any effect on malaria? And then they find out, B has an effect, but the effect that B has is not as strong as the effect that A has. And then they say, okay, fine, let's combine A and B and see the effect. And they find out that A and B together do a greater job. And then they check C and they find out that, C is a poison. It actually is harmful to the body. Eventually, the conclusion from all these studies is that they sit down and they say, okay, fine, from this leaf, we have to separate C, which is poisonous. We have to take A and B together for the effect we want to achieve, and determine that, this is the amount of A and B that is sufficient to give us the effect we need. This is the amount that will be harmful to the body too. So based on different age groups, based on weight, they sit down and then they say, take 2 tablets 3 times a day, and so on. Now, with herbal concoctions, apparently, there is no way to say what is in that herbal concoction preparation. Also is the fact that there is no way to determine the concentration. Mr. A will prepare the same herbal concoction and will use a lot more water, or in some cases they are alcohol-based herbal concoctions, and the concentration that everybody prepares is different. Also is the fact that in that herbal concoction is the good, the bad, and the ugly. There is no way to determine safely how much is enough, how much is too much, how much is too little. And it is known that a lot of these herbal concoctions over time have negative effects on different parts of the body. A lot of people have had kidney failure, the liver problems, which could be traced to the use of herbal concoctions. There are heavy risk factors such that if you check well, if you are able to actually isolate the herbal concoctions the person has been taking and check what is in there, you might actually find out that this is what has done harm to this person. And this is particularly important in children because they are delicate, they're growing, and they really don't have a choice. Parents force them to take these things and they have to take it. And when evil happens, when things go wrong, a lot of times people do not trace it back to those herbal concoctions. So, are herbal concoctions bad? Are they harmful? Well, that's really not the issue. The issue is an inability to tell what is in this herbal concoction, in what concentration, what part of it may be harmful to the body, how much is too much, how much is too little, and basically that puts us in a situation where in orthodox medicine, we will not advise the use of herbal concoctions because we cannot speak for their content and their effects, whether positive or negative. So it's your choice really to make, but it's safer to deal with issues based on science, based on evidence, than to trust in hearsay. Oh, this is what we've been doing from the ages past. Oh, and the parents will tell some of us that are doctors that this is how we raised you. We raised you on herbal concoctions and you're fine. You're a doctor today, so it really doesn't matter. Well, we are the fortunate ones who probably escaped. There are some who probably died. There's some who probably did not achieve the potentials they could have because of the harm that these herbal concoctions might have done. So think through it and make an informed decision. Bye. Hello fellas. Let's talk about skin problems and the common use of these triple action creams. Now, skin problems are wide, okay? There are different ways that skin problems can be classified, but for the purpose of this discussion, I'm going to limit myself to three things. Skin problems that are due to allergic reactions or the body's allergic system, skin problems that are due to infections, which could be bacterial, could be viral, or could be fungal. The body has a defense system by which it fights infections, foreign cells, and things of that sort. Now, in the body's defense system, you have different elements. You have the white blood cells in the blood that fight infections, which usually would increase in number when there is an infection. And then there are several other elements. However, the skin is a part of the body's defense system. And when it comes to allergies, the basis of allergies is that the body, which normally would react to get rid of foreign agents, harmful things like germs or foreign cells, overreacts in people who have allergic problems. I'll use asthma as an example. Normally in your breathing system, you have mechanisms that help to keep germs, keep foreign things out. So if you're exposed to dust, if you're exposed to smoke, you most likely would just sneeze or cough. All these are the body's mechanisms to get rid of dust, foreign things that could be harmful. However, in the asthmatic, a little exposure to dust, smoke, strong smells, little things like that, and it's like the body gives an instruction, hey, close the gates, don't let the enemies in. And then what the body does in response is to actually close the gates. And then air cannot get in and out freely, and then there's so much secretions, and then the person is struggling to breathe. So what was meant to help the body now becomes a disadvantage. Now, taking this back to skin issues. Normally, when the skin comes in contact with germs or with certain foreign things, the body has its system to respond to these things. So you have an insect bite and the place becomes a bit red, it's swollen. It's a combination of two things: what the bite of the insect caused and the body's reaction to try to deal with that event. Now, in people who have allergies, the tendency is that their skin overreacts. So a little dust mite and the place is all red and bumpy. So there are skin problems that could be due to allergic problems. So not necessarily in people who have background allergies, and it could be in response to a bacterial infection. So there's an overlap. It's not like they're separate, but just for the sake of explanation, I'll set them apart. Okay, so there are the skin problems that are due to the body's allergic response. Now, there are skin problems that are due to infections. They could be bacterial infections, which could be primary to the skin, or manifestation on the skin of infections in the body. That's even more common with viral infections, where you have a viral infection in the body and then there are skin manifestations, from as simple as what we call viral exanthems, where you have this fine rash all over the body, and then you could have more serious things like chickenpox, measles, skin manifestations of diseases or viral illnesses in the body. You could also have fungal infections, which are pretty common. Fungi generally like warm and damp areas, so the tendency is that you find fungal infections in crevices, in areas a bit hidden, areas where moisture can gather. These different skin problems have different solutions. There's a different way you handle a bacterial skin lesion as against handling something that is viral, as against handling something that is fungal, and so on and so forth. Now, there are several medicated skin ointments out there to solve these problems, and very common among them are these triple action creams. These triple action creams go by different trade names. You have Combact A, you have Tribotan, you have Skinil, and you can go on and on mentioning names of different types of these triple action creams. They combine an antibacterial and an antifungal, as well as an anti-allergy, usually steroid medications. These triple action creams bring all three together to solve problems that could combine all these three problems. Now, the truth is, not all skin lesions have these three components. Hence, not all skin lesions need triple action ointments. The problem with using these triple action creams, if eventually the skin problem continues to get worse and is not well resolved, by the time you eventually get to a doctor or even a dermatologist to identify what the problem is and solve it, this creams that you've used has altered things a lot. You have people who lesion goes, it comes, it just flares up. And by the time you're getting to the doctor, to the health professional who knows what to do, it's a bit more difficult to tell what was the initial skin problem and how was it modified by this triple action cream you used. Now, the major concern with these triple action creams is the steroid part of it. Steroids have their good effect in reducing the body's immune response. There are different things in medicine for which we choose to use steroids, and basically it is to moderate how the body reacts to infection, to different things, even when it comes to organ transplant and so on and so forth. However, steroids have a lot of side effects that come especially from prolonged illicit use. In terms of using it on your skin persistently, they make the skin thin. And of course, remember we said the skin is part of the body's defense system. So the skin is unable to carry out its function properly. The skin is thin, hence the barrier or against infection and things like that has been weakened. Okay? And then it causes several other problems. Stretch marks, bleaching. Yes, many of these bleaching creams contain steroids. It is horrible to know that some people put these triple action creams in their regular body creams. And I guess it's in a bid to, for some, prevent these skin problems from occurring, for some, perhaps to get that skin lightening effect. Well, the truth is this: you're doing yourself a lot of harm. You know what? Still, you have parents who put steroid tablets in their children's food so that they can be fat and round and fine. Well, you're causing a lot of problems. It can cause high blood pressure, predisposed to infections, among several other things. So, what really is the conclusion of this matter? You have a skin problem. You have to go to the hospital. You have to go to a doctor. These health professionals have been trained to identify problems and solve them. When you do not go to them and you seek self-help, more often than not, do yourself. More harm than good. If you recall, we had a discussion earlier on self-medication. I think you should go back and look at that video. It will do you no good taking over-the-counter skin ointments and applying to every skin lesion. Not every skin lesion is eczema. It's not every skin lesion that needs a triple action ointment. Do not do yourself any further harm. Desist from illicit use of triple action ointments. Hello fellas, let's talk about some practices that are commonly done out there for newborn babies and find out if these practices actually have any basis in medicine. One of the common things that people who take deliveries tend to do is when these new babies are born, the antibiotic Ampiclox is prescribed, and then you have certain multivitamins such as Abidec that are given to the babies. And the basis behind the prescription of these medications is supposedly to prevent jaundice. Well, the first thing is let's address what exactly jaundice is, why it happens, and what can be done about it. Then we'll be able to make sense out of whether there is any basis for the use of these medications in newborn babies. Jaundice is due to something in the body that is called bilirubin. It's actually a byproduct mainly of the breakdown of excess blood cells. Usually, a newborn baby has a lot of blood cells, red blood cells to be specific. And that's because while they're in their mother's womb, their environment has relatively less oxygen. Hence, the body produces a lot of red blood cells to be able to carry oxygen, more oxygen around the body. Hence, when they're born and then there's more oxygen around, the body senses that, well, we don't need this many blood cells. Let's start breaking down the excess. And generally also, red blood cells have a time span during which they survive. They are produced, and then after a number of days, it will be destroyed. You can refer to our discussion on blood group and genotype. It might help to enlighten you more in that regard. Now, when these red blood cells are broken down, the eventual byproduct is what we call bilirubin, and this is what causes the yellowness of the eyes, that causes the yellow skin pigmentation. Now, usually, jaundice could be physiologic. When we say physiologic, we mean what you can call a normal jaundice that is just due to the fact that those excess blood cells are being broken down. However, jaundice could be due to certain abnormalities. Now, one of the things that can happen is a mismatch in the mother and baby's blood group. This is common when the mother's blood group is O, whether positive or negative, and the baby's blood group is A or B, positive or negative. Again, you can refer to the earlier discussions we had on blood group and genotype for more details in this regard. Now, in that situation, because of the mismatch of the mother and the baby's blood group, you have a situation where the blood cells in the baby are being broken up faster than usual, or more of them than usual are being destroyed because the soldiers, that is the antibodies from the mother's blood, which normally would fight against antigens A or B, are now attacking the baby's blood, causing the breakdown of the baby's blood cells. Now, also, you could have a situation where the mother is rhesus negative and the baby is rhesus positive. A rhesus negative mother, when sensitized, will produce antibodies, that is soldiers that fight antigens, that is the skin coating of positive blood cells. So you can have a baby born to a rhesus negative mother that has been previously sensitized, that is born with that process of destruction of the red blood cells already happening. Other situations can happen, such as a baby that has not been well fed, okay? A baby that is not well breastfed when born is at risk of higher levels of jaundice because of certain processes that happen because there is not enough food getting into the digestive tract. Also, you can have a situation where, due to a certain element in breast milk, some babies have what we call breast milk jaundice, where over time they develop a high level of jaundice because of something in breast milk. And in those cases, you basically just have to stop breastfeeding for a short while, 24, 48 hours, and the level of the jaundice crashes, and then you resume breastfeeding and everything is fine. Another thing that can cause jaundice in newborns, particularly in male children, is something that we refer to as glucose 6-phosphate dehydrogenase deficiency. When this baby's blood is exposed to certain things, the blood cells begin to break down faster than usual and in larger quantities than usual. And part of the things that can result in this is exposure to naphthalene balls, what many of us would know as camphor. Families that store their clothes with camphor inhibit to ward off insects like cockroaches and the likes. Also, exposure to mentholatum, which you will find in things like silverbird, which some mothers opt to put in the baby's bath water, supposedly to clear the baby's airway, among other things. Some will use it in different forms, sometimes on the umbilical cord and all that. And these are things that can be a problem. Also, infection generally is something that can cause a rapid breakdown of blood cells. So if there's infection in a newborn baby, which could be due to certain issues in the mother, for example, a mother who had been draining water, that is liquor, for over 12-18 hours prior to the delivery of the baby is at risk of infection. A mother who has had an abnormal vaginal discharge that has been left untreated, there's a risk that the baby will come down with a newborn infection, which we will refer to as neonatal sepsis. And of course, this infection in the newborns, which could be different due to different causes, either maternal or baby is born, in a dirty environment, or delivered by people who are not healthcare professionals that have been well trained to know what to do. The baby is at risk of infection, and then the care of the baby at home. Generally, all these things are contributory. So generally, the umbilical cord ideally should be kept free of things like powder or mentholatum, or just covering it in cotton wool. Ideally, the umbilical cord should be sanitized with methylated spirit on cotton wool, or in some cases something such as chlorhexidine gel that keeps it clean till the cord eventually falls off. So these different things can cause jaundice in a baby. Now, what is the major concern about jaundice in babies? There's something we call the blood-brain barrier, which protects the brain from certain things in the blood. So it's like a filter. It keeps out things that can be damaging to the brain and decides what it will let in, what is beneficial to the brain. Now, in the first 1 week of life, that barrier is not well formed. Hence, anything in the blood will get to the brain, and bilirubin is toxic to the brain. So a baby that has a very high level of jaundice is at risk of brain damage and with certain other results. Hence, jaundice can be a major issue. Now, that takes us back to this practice of ampiclox and multivitamins for newborn babies. Now, a baby that does not have any infection or had no pre-existing risk of infection has absolutely no need of that antibiotic, apparently. It's not going to do any good, neither is it going to prevent jaundice in the baby. The multivitamin will do no harm, but the truth is this: a baby that is breastfed from birth has all the baby needs. The baby does not need any of those multivitamins to do well. They do no harm, but they do no extra good. So it makes no sense to routinely give newborn babies ampiclox, multivitamin when they're born, supposedly to prevent jaundice. Now, in the event that jaundice does occur, one of the concerns is this: a lot of the time, parents do not observe that jaundice is developing because the baby is often over-covered. Now, it's understandable that newborn babies are not very great at maintaining their body temperature, hence the need to keep them warm. However, the truth is this: while babies are not small adults, they also understand the discomfort that comes with a hot weather or the discomfort that comes with a very cold weather. They prefer a cool atmosphere, a cool weather, rather than one that is hot or too cold. Hence, when you overdress them, you put one inner, then another outer, and then you wrap them in shawl, and then the weather is hot and you are sweating and you're putting on very light clothing. The truth is that firstly, you're burning them up, you're making them uncomfortable. Secondly is that because you're not paying any attention, you may not notice when the yellowness of the eyes and the skin develops. So don't overdress them. Dress them according to the weather at just the necessary, decent coverage to keep them warm and safe. So you have this newborn baby, whether in the hospital or at a health center, where someone who knows what they're doing takes delivery of the baby, as if there was no risk for infection in this baby. This baby does not need the ampy clocks. In the event that you notice jaundice at any point in the care of the baby, yes, in the baby under early morning sun can be helpful, but it will be advisable for you to get that baby to the nearest hospital to be checked out by a doctor to determine the extent of the jaundice, perhaps run certain tests to see what the bilirubin level is, to see if it is safe enough to manage that baby at home without doing any extra, to see if there is any mismatch of blood group, to see if there's any infection, and the other things that we earlier talked about, and attend to them as necessary. Bye. Now, there are other practices such as pouring a lot of oil or putting thread on the upper part of the head that is soft, what we refer to as the anterior fontanelle. Now, different tribes have different names by which they refer to this thing. I think Yoruba people call it oka. And the odd thing is that there are some people who have some weird beliefs about that area of the head and say that if it's too wide it kills children and so on and so forth. Well, first and foremost is that that's not true. The anterior fontanelle exists because the skull is made up of a number of different bones. It is as you grow older that the skull bones eventually fuse and then there is no space. So because they are like four bones meeting at the center here, you have that diamond shaped opening there. And it's soft because apparently there's no bone covering over there. It's just skin. You can basically feel the softness of the tissue, the brain tissue, and its covering. Now, that area can actually tell us if there's something wrong with the child. For example, if the child is dehydrated, it's likely going to be sunken. If the child has an infection around the brain and the coverings of the brain, it could be bulging and tense. However, this area does not need excess oiling. The way you oil the hair normally is sufficient. When you pour too much oil over that area, you inadvertently block the pores and you predispose the child to having something we call cradle cap, certain skin problems where the pores are blocked and then secretions cannot get out freely and then it causes problems. So there's absolutely no need to pour excess oil over that area. It doesn't do anything extra. Putting thread there, there is really no basis. It has no medical advantage. Just creaming the baby's hair normally, leave that place, you can take good care of the baby, and the baby is fine. Covering the baby in powder, it has no added benefit. Firstly, there are normal skin lesions that they can have. There's something we call milia, which are certain kind of white reddish rashes that you can find on the forehead and the likes, and they're normal. They're things that we may not be bothered about. But of course, when you overdress the baby develops heat rashes, fine rashes around the neck and all that, and then you bathe the baby in powder. It's not necessary, and dusting powder, because of its content, also can increase the risk for jaundice.
Hi fellas, have you ever heard the mother of a child who is having a fever or is passing watery stools say to you, oh, perhaps this child is just teething? Well, I've come to bust your bubble. Teething does not cause a fever. We've recently had a discussion on what a fever is, what the steps to take are in taking care of a fever, so I won't go into all those details here. However, while teething may cause some discomfort in the child and raise the body temperature slightly due to the processes that are going on which involve the teeth burrowing through the gums, a noticeable fever is almost certainly not due to teething. The likely reason for this confusion about teething causing fever or stooling in children is that while children are teething, the tendency is that to ease the discomfort, they take anything and everything to their mouth. And during this period, they are increasingly exposed to germs and can come down with infections that can cause the body to mount a fever or cause them to pass loose stools. You might also want to be careful with these teething mixtures. A good number of them contain paracetamol, and the tendency is that their prolonged use can mask a fever that is actually a warning sign that there is something sinister going on in the body. So let it sink in. Teething does not cause a fever. If there is a fever, there's something going on in the body. Tepid sponge, give paracetamol, and get to the nearest healthcare center and have that child checked out. Hi fellas. I guess for parents and people who take care of children, it's a lot of relief that schools are about to resume, as you can get a break from children running around the house and causing a lot of trouble. Well, the other concern that exists is that as children resume school, there appears to be a surge in children taking ill, especially with upper respiratory tract infections and some more worrisome infections, sometimes requiring the children are hospitalized or placed on intravenous and oral medications. So what can you do as a parent to reduce the incidence of this happening to your child? Let's have a quick gist. To start with, children, particularly those under the age of 5, have immune systems that are still learning. The body's foot soldiers, the white blood cells, are being trained to recognize different germs and develop armory against them in case such enemies attack again at a later time. Now, having spent a lot of time at home, these children's bodies have grown familiar to germs around the home and can keep them from causing illness. However, on return to schools, the children begin to share germs, sort of, and the respective immune systems of these children have to start the learning process all over again. Now, this explains the reason why it's not uncommon to have these events occur, especially in the first few weeks of school resumption. There are, however, a few things we can do as well as teach our children to reduce how frequently they are affected. Now, first, it's our responsibility to strive, even in difficult times, to ensure that our children have healthy diets. You want to cut down on junk food, home-cooked food as much as possible, and as nutritious as possible is preferred. Now, this would imply doing the best you can to ensure that their meals are not packed full of just carbohydrates and processed foods such as noodles, pasta, or just white rice in stew. They need the proteins, they need the fruits and vegetables, so do your best as parents and guardians to see to this. Secondly is the importance of teaching our children to wash their hands repeatedly, not only after they have finished using the toilet. Don't get them hysterical about germs, but help them understand that keeping their hands clean helps to keep them healthy. Hence, after playing, if they feel they've gotten their hands dirty, after sneezing or coughing, they should, within acceptable limits, wash their hands, preferably with soap and water, but at the minimum, with water if soap is not immediately within reach. Very importantly is also to teach them to cough or sneeze into their elbows like this, rather than cough into their palms or into handkerchiefs. Doing the latter increases the tendency that they will transmit germs. However, coughing into their elbow reduces the incidence of transmitting germs because there's less contact with the cleft of the elbows. Also, ensure that your children get all the needed vaccinations and booster doses. Now, not all vaccines are available on the National Program for Immunization schedule, though most of the important ones are. If you can afford the paid ones, they can give some added benefits, so please, by all means, get them. Also, this is not a time to start loading these children with antibiotics, antimalarials, and other medications prescribed and dispensed by you. Some of these infections these children come down with are viral infections, and they will need no special treatment but to take care of the symptoms. I understand you don't like the idea of frequenting hospitals or health centers, but please, for the sake of your children and our collective good, stick to simple over-the-counter symptom relief medications such as paracetamol, antihistamines as the first port of call. And once symptoms are persisting or becoming alarming in over a day, please get the child checked out for proper diagnosing and treatment. We had a discussion earlier on the dangers of self-medication. If you didn't follow that video series, please go back and listen again. Finally, do not panic. If there's nothing fundamentally wrong with your child's immune system, the defense system fights off a good percentage of those germs unaided. And in general, whether the body's immune system needs help or not, the immune system is basically learning how to keep your children's bodies healthier as they grow. So, your children are going back to school, ensure that they have a healthy diet, ensure that you teach them to wash their hands frequently, ensure you teach them to cough into their elbows rather than into their palms or into a handkerchief. And if they do take ill, use initial symptomatic relief such as tepid sponging, antipyretics such as paracetamol or antihistamines where the need arises. However, if the symptoms persist or are getting alarming in a day or two, please take them to the nearest healthcare center, have them checked out, and they'll be fine. Happy resumption to parents and their children. Bye. What your son has could have been prevented. It's called pneumonia. Pneumonia is an infection in the lungs caused by bacteria, viruses, or fungi. It's not caused by drinking cold water or exposing one's chest to the open air. While that is not encouraged, it's not the primary cause. Do you have any questions, madam?
Please, doctor, is there a medicine we can take or something we can do to stop it so that it will never happen again?
Well, there's an easy way to help parents and to teach children in order to prevent pneumonia. It's called Hide Me.
Doctor, is Hide Me a game like hide and seek?
Well, Hide Me is more about hiding children from pneumonia, not children looking for pneumonia. H stands for hand washing. Proper and frequent hand washing after being outdoors, after playing, after using the toilet, before a meal, and after touching a sick person can help to prevent pneumonia. I stands for immunization. Proper immunization can prevent pneumonia. Vaccines are free and available at your nearest primary health center. D stands for diet. Eating a healthy and balanced diet will give the strength you need to fight the germs that cause pneumonia. E stands for exclusive breastfeeding. When babies are exclusively breastfed for the first 6 months of life, they can be protected against pneumonia. M means move away from smoke. This includes all types of smoke, ranging from the smoke from cigarettes to smoke from car exhausts and cooking fires. The last but not the least is E. It stands for the elbow dab. When you cough or sneeze into your elbow like this. Can we try that? Good.
According to the World Health Organization, WHO, pneumonia is the single largest cause of death in children worldwide. It claims the life of a child every 3 minutes in Nigeria and kills a child every 30 seconds worldwide. Let's stop pneumonia today.
Hello fellas, ever wonder why people snore or would like to know possible solutions to this snoring problem? Now, snoring can occur both in adults and in children, and snoring is due to difficulty of air getting into the breathing pathway, either through the nose, the back of the throat, basically the upper airway. And snoring, especially in adults, about 50% of the case is not because there is a major problem. In fact, snoring could just be due to problems in positioning. So the way you are sleeping is such that your airway is obstructed. It can happen in adults, can happen in children, and sometimes all you need to do is change your position. You know, if you're lying on the back, you want to lie on the side. These are simple things. However, snoring could be due to certain problems, especially in children. In children, if there's snoring, more often than not, there is a problem. In adults, it might just be certain things that need to be taken care of. The major issue with snoring is what we call obstructive sleep apnea, where you have a situation where there's so much difficulty breathing. It can get so bad that such that you see the child struggling to get air in, and at some point they can take a pause for a while and then resume breathing with a very loud snore. It can cause a lot of problems, particularly in children. Obstructive sleep apnea can hamper their growth because they're not getting enough oxygen in there, so it hampers their growth generally. So a child with a serious snoring problem may need quick help before things degenerate. An adult with obstructive sleep apnea will also need help to ensure that it doesn't become a major problem. Let's talk about snoring in children. More common is snoring due to what we call adenotonsillar hypertrophy. Now, in the body's immune system, there are different checkpoints. There are the smaller checkpoints that are referred to as the lymph nodes. They signal when there is an infection or abnormal cells moving around in a certain part of the body. So if you've ever had a sore throat before and had this feeling of some painful balls under your chin hair, those could be enlarged lymph nodes. Now there are bigger ones. You have the tonsils that are at the back of the throat. There are two of them on either side, and the tonsils are what are usually implicated in what you will call the sore throat, which more often than not is a case of tonsillitis. So they can get enlarged, they can become red, they can become painful, making it difficult to swallow, and if it's bad enough, it can also hamper breathing. It can change your voice. Now there are the adenoids that are at the back of the nose. They can also get enlarged. They are like the barracks. The tonsils, the adenoids are like the barracks. Usually, just like in an insurgency, there's a lot of activity around the area, the soldiers, police going all over the place. That's exactly what happens when there's an infection around the area of the throat, the back of the nose. Now in children, it's more common that you have enlarged adenoids in children who have some background of allergies. But either way, you can have the tonsils enlarged, the adenoids enlarged, and if they're blocking the airway, air can get in easily and come out easily. So you have children like this come down with repeated, what we call upper respiratory tract infections, where they're having cough, they're having catarrh. At night, there's a lot of snoring, Now, adenotonsillar hypertrophy is something that in some cases it's thought that the infections can be treated and the child outgrows it. In some cases, they may need surgical repair. So if you find your child snoring and you can't really solve it by changing the position of the child is having repeated upper respiratory tract infections, cough, catarrh, always sniffling, you may want to get to the doctor and have that child checked out. Now, in adults, snoring, like I said earlier, 50% of the case could just be normal. However, there are certain things that can make snoring worse in adults. There is the issue of not sleeping well. If you're very tired and you're worn out, there is a tendency that you would snore while asleep. Also, weight, okay? This also applies to children, by the way. Excessive weight gain, obesity is a major risk factor for snoring. Also, smoking, drinking alcohol, these are things that have been found to be associated to snoring. Now, really, there could also be issues with adenotonsillar hypertrophy in adults, not as common, but it could also be involved in snoring. So let's put it together. Snoring, whether in children or in adults. First thing is reposition. If you lie on your back, you want to try lying on either side. It may help the problem. Also, you want to identify in adults smoking, alcohol intake. These are things you want to cut down or stop altogether. You want to ensure you get good sleep, otherwise you likely will snore. In children, it could be due to adenotonsillar hypertrophy especially, and these may need some surgical correction depending on how severe the problem is. Let's take a moment and talk about cleaning the ears. I'm sure a number of you that are listening to me have this practice of using cotton-tipped swabs, or as we call them, cotton buds, to clean out our ears. And it's based on the supposition that our ears are dirty. Now, newsflash. What you call dirt in your ears is actually earwax. And earwax is not dirt. Earwax is actually a lubricant that helps to moisten your ear canal and keep it free from irritation. Also, it has some degree of antibiotic effect and helps to keep germs out. Also, in addition to the hairs, the tiny hairs in the ear that is referred to as cilia, they help to keep small insects out of your ears. Hence, earwax is not harmful, rather it's beneficial. Normally, when you do not disturb the equilibrium, the balance in your body, the body has its system of producing earwax and clearing out the excess. Except in certain people who have certain abnormalities in how their ear canal is structured, earwax naturally should not accumulate on its own. Now, these are the problems that are associated with you thinking you are cleaning out your ears. First and foremost, when you say you are cleaning out your ears and you put that cotton bud and clean out a certain area, what you have done is you have exposed that area of your ears to dryness and irritation. And as such, many people who clean their ears often end up always itching their ears every now and then, which is a vicious cycle. It makes you want to stick something in there again. More concerning is the fact that you are actually pushing earwax further down into the ear canal. You think you are getting wax out, but you're pushing wax in, and over time it accumulates, and then you develop wax impaction, which can present with a lot of ear pain, can present with a lot of itching. Your hearing can reduce. Of course, other things that are involved in causing wax impaction in our day and age, it's a bit of an epidemic that everybody is using AirPods, headphones and the like, but the ones that particularly plug your ears in the name of supposedly noise cancellation are probably worse, in that you shut out everything around you, and depending on how loud the music you listen to, it has a way of also causing gradual trickling of wax further into your ear canal, besides the fact that it stimulates the ears to produce a lot more wax. Generally, cleaning your ears using earbuds and listening at loud volume, these are things that can predispose you to wax impaction. Of course, another dangerous thing that can happen in the process of you trying to clean your ears is that you can actually damage your eardrums while you're pushing the cotton bud in. Now, as touching parents and children, this is a major concern. A major concern because while you are trying to clean the ears of your children, inadvertently, you are teaching them how to put things in their ears. It's common that we find children having stuck things in their ears. You find children who have stuck broom in their ears, supposedly trying to clean it or to ease itching. And then you have them end up with ear infections. Some of them perforate their eardrums. And the truth is this: you taught them how to put things in their ears. If they did not see you putting cotton bud in your ears or see you doing the same for them, they probably never will think about putting anything in their ears. But thanks to you, mommy, thanks to you, daddy, they've learned how to put things in their ears. Something you really want to desist from, so that you do not do further harm to yourself, so that you do not do further harm to your children. So the ears do not need to be cleaned out. Normally, if you leave things, the ear has its own balance. It produces wax, it clears out the excess. Occasionally, either due to some abnormality in your ear canal, some people may have wax accumulate and impact their ears. Other possible causes exist. If there is wax impaction, then it takes a doctor looking into the ears, and it may be necessary to do an ear syringing where the ears are washed out, or simpler, certain ear drops that are known to break down excess wax could be prescribed, which will help get the excess wax out. So you do not need to clean your ears. Leave your ears alone. Hello fellas, what's your genotype? What's your blood group? I bet it that the majority of you that are looking at me either do not know your genotype and blood group or can't tell which is which, whether it's AA or it's O or it's this or that. Now, I'm going to attempt to take you briefly through what genotype means, what blood group means, what their significance is, and why you should know your blood group, why you should know your genotype, and how it impacts on the decisions you take, how it impacts on your life in general. Now, when we talk about genotype and blood group, what we're referring to is that part of the blood called the red blood cells. Okay, red blood cells are responsible for carrying oxygen around the body, and a major part of the red blood cells that helps to carry out that function is what we call hemoglobin. Okay, so when we talk about genotype, we're referring to the hemoglobin genotype, and when we're talking about blood group, we're talking about what defines the coating of the red blood cells. So in simplistic terms, let me put it this way, it might help you understand. Genotype would refer more to like your personality, while your blood group will refer to the clothes you put on. Okay, so the clothes you put on have a certain way it defines you, but your genotype is actually who you really are and how you manifest. Let's start with blood group. So there are two blood group systems that we use commonly, which is the reason why, if you're familiar with the blood grouping system, you're usually said to be something positive or something negative. We have the ABO blood grouping system, and then we have the rhesus blood grouping system. Now, the blood grouping system basically has to do with having something or not having it, in simplistic terms. Now, for the blood groups A, what you have is the antigen A. For blood group B, what you have is the antigen B. For blood group AB, what you have is the antigens A and B. And from blood group O, you have no antigen. Antigens are like a soldier's uniform, a specific uniform belonging to a specific army division of a country defines. If you see that person, you can tell that this person is a soldier from so and so country. Antibodies are like weaponry that fire against foreign soldiers. One with blood group A, with antigen A, okay, does not have B. Hence, we will have soldiers that will fight against B. Someone with antigen B does not have A, so we'll have soldiers that fight against antigen A. Someone who has antigens A and B will have no soldiers that fight A and B, because that would imply fighting yourself. And then someone who has antigen O doesn't have any antigen, hence will have antibodies, that is soldiers that fight against any other antigen, A or B. Let's take it from there now. We have blood groups A, B, AB, and O. Fine. Now, the rhesus blood grouping system, on the other hand, has to do with having rhesus D present or rhesus D absent. So someone who has the rhesus D antigen is rhesus D positive, and someone who doesn't have the rhesus D antigen is rhesus D negative. So bringing this together, you have the combined blood group system. You can have someone who is either A positive or A negative, B positive or B negative, AB positive or AB negative, O positive or O negative. Where this matters is when it comes to things like blood transfusion, organ donation, and the likes. The implication is that someone with blood group A cannot donate blood to someone with blood group B, because blood group B has soldiers that will fight against the antigen A. Same applies to B to A. Now, someone with blood group A or B can give blood to someone with blood group AB, because the person has both antigens but no soldiers to fight them. Now, someone with blood group O apparently has soldiers to both A and B, and so cannot receive blood from either someone with blood group A, blood group B, or blood group AB, because if he receives such blood, the body immediately goes into a battle to kill off those strange blood cells. Now, a slight difference exists with the rhesus D blood grouping system, such that someone who is rhesus D negative does not have pre-existing antibodies. Remember, antibodies are soldiers, okay? Antibodies that will fight against the rhesus D antigen. So someone who is rhesus D negative would only produce antibodies, that is soldiers that fight rhesus D antigen, when their blood comes in contact with rhesus D positive blood. And this is particularly important in women. Any woman who is rhesus D negative, her blood group being whether A, B, AB or O, it's important that if she gets pregnant with a child that is rhesus D positive, what is called sensitization can happen during the course of delivery, such that due to a mix of the baby and the mother's blood, the mother is primed to begin to produce antibodies, that is soldiers that fight against rhesus D antigen. Now, the implication is that if the mother does not get a special injection that we refer to as Rogam, okay, which is basically a drug that works to prevent sensitization from happening, that is, that prevents the mother from beginning to produce those antibodies, that is soldiers against the rhesus D antigen. If she gets pregnant a second time with a child that is rhesus D positive, her body immediately begins to fight that baby while the baby is in the womb. And this is something that can result in the death of the child. There's a medical name for this condition. I won't bore you with that, but basically the mother can kill the child while the child is in the womb, or the child is born and the child struggles to survive because a lot of the blood cells have been destroyed while the child was in the womb. So back to the blood grouping systems and the implication for transfusion. We've said earlier that blood group A cannot give blood to blood group B, B cannot give to A can give to AB, okay? B can give to AB because they don't have soldiers against A and B. However, O can only receive from O. Now add the rhesus D blood grouping system to this, and the implication is that someone who is rhesus D negative can give blood to someone who is rhesus D positive, as long as the person's ABO blood group system matches. Now, in order not to bore you with so much more of the details, the important thing is this: blood donation is life-saving. Blood cannot be manufactured in any lab. That implies that when people need blood, blood has to be donated by somebody to save the life of that person who needs blood. And that because of the issues of different blood types, it's important that hospitals have blood banks that have different blood types to meet different needs. For example, we talk about O negative being a universal donor that can give blood to anybody. However, someone who with the blood group O negative cannot receive blood except from someone who is O negative, okay? So you have people like that who have peculiar needs. Blood should not be sold. Legally, our law does not permit selling of blood. Hence, the only ways for hospitals to get access to blood to help people is either by replacement donation or by voluntary blood donation. Now, blood donation is not harmful. Usually, before any standard lab would bleed someone in view of helping with a pint of blood for someone that might need it, they usually do a basic testing to see to it that you're fit before blood is taken from you. And it is believed that someone who is fit can confidently give out that 500 mils or so of blood without it affecting the person's hemodynamic status. That is, the body system does not know that much has happened. The good thing about blood donation is that it keeps your bone marrow where blood is produced healthy and working hard, such that for a longer period of time you have good blood cells being produced. So I will want to encourage you donate blood. I find a lot of people come with their relatives to the hospital, and then when they're told to donate blood, they find it difficult. They are looking for touts who will collect money from them to donate blood, and it's difficult for me to understand why people are so scared of blood donation. I am a voluntary blood donor, and it is helpful. You are saving lives, but you are also improving your own quality of life. So please donate blood. Donate blood. Donate blood! Let's get back on the issue of genotype. There are three major genotypes that people are familiar with. Genotypes AA, AS, and SS. Now, there are more, okay? However, I'm just going to add on two more to make this very simplistic and easy for us to understand. We also have the genotypes AC, we also have the genotypes SC, and we also have the genotype CC. Now, the reason why genotype is always in pairs is because you got half from your dad and half from your mom, okay? So someone who is genotype AA got A from both dad and mom. Someone who is AS got A from one party and got S from the other party, and so on and so forth. Now, the implication of this is that it's important you know your genotype, and it should influence your choice of a partner because of the results that can come from it. Now, that A part is the normal hemoglobin type that does its job normally. S is a defective hemoglobin, and C is a weaker variant of the S gene. So someone who has genotype AS is a carrier of the defective sickle cell gene. Someone who is genotype AC is a carrier also of the sickle cell gene, however a weaker type, the C. Someone who is genotype SS carries two defective sickle cell genes, hence they manifest the disease. Someone who is genotype AS may not fully manifest the disease, could have some features, but usually they are not prominent because the A seems to carry more of the activity, and you don't really find people with genotype AS come down with the same problems that people with genotype SS may come down with. Now, because the C is a weaker variant of the S gene, you can have someone who is genotype SC who will have less problems than someone who is genotype SS, and someone who is genotype CC who will have less problems than someone who is SC or SS. Now, let's talk about the sickle cell gene. Sickle cell hemoglobin has certain mutations that occurred in that gene, and the resultant effect is that for those who carry this gene, particularly those who have SS, less commonly CC, but because of the defect in their hemoglobin, when there is reduced oxygen, when there is reduced fluid in the body, in stressful conditions, in cold weather, infections, among other things, what happens is that that hemoglobin changes shape. Now, the normal red blood cell looks something like Trebor, if you're familiar with it, or Mentos. However, they're very tiny and they are very flexible. So when they're passing through big blood vessels, they swim side by side. When they get to very small, tiny blood vessels, they tend to fold so that they can squeeze and pass through. However, in those who have genotype SS, SC, or CC, SS being more serious than SC than CC, what happens is that the hemoglobin in them become firm and hard crystals, which changes the shape of the red blood cell into a rigid sickle shape. So they look something like this under the microscope, like a sickle that you use to harvest rice. And those sickled cells cannot pass through the tiny blood vessels. As a result, they begin to cause obstruction as they gather together and they block those small blood vessels. And because These small blood vessels are usually supplying certain kind of organs like the bones. You have a situation where, because blood is not getting past the obstruction, you have experience of things like pain. Okay, so pain is one of the major things that those with sickle cell disease suffer. They can have excruciating pain that some of them would describe as, for those who are women and me have experienced labor pains, something that is probably worse than that. There have been terrible descriptions that you have people with sickle cell disease tell you to describe how much pain they are experiencing. This pain is basically the body signaling and saying, I am not getting blood, I'm not getting oxygen, I'm not getting nutrition. So this is a major problem that they face. Now, there are several other issues. Because of this obstruction, you can have them have stroke. So you have children having stroke because of sickle cell disease, because blood vessels in the brain have been obstructed. Blood is not getting to a part of the brain. You can have different organs in the body affected. Their kidneys can stop working, and you can go on and talking about the effects on different organs of the body. You can have repeated infections because their immunity is not so strong. Different parts of the immune system, the body's defense system, and cannot work well because of this problem. The spleen, for example, these sickle cells get stuck in there. The spleen cannot do its work properly in dealing with certain kind of bacteria, so they're susceptible to certain kind of infections. People with sickle cell disease generally live on a lower blood level than the average person, because these sickle cells tend to get destroyed easily when they get stuck in those blood vessels. The pressure of blood flowing, they easily get fragmented and broken up. Also, malaria infection in someone with sickle cell disease can be very disastrous, because those infections tend to affect blood cells generally, even in someone with the genotype AA or AS. So they already have few blood cells, and these blood cells are now being further destroyed by the infection, whether bacterial or malaria or whatever it is. So sickle cell disease, sickle cell anemia, which is the SS, is very serious. I speak about this with so much passion because I have people who are my patients. I have people who are friends and loved ones whose pain I see every day, whose pain I feel. And it's heartbreaking that we might not eradicate sickle cell disease in our part of the world for perhaps another 100 years, because we still have young couples in this day and age who, either based on ignorance or pig-headedness, are making decisions that are resulting in the birth of these children with sickle cell disease. So how does this affect you? Firstly, if your genotype is AS, the implication is that you're a carrier of the sickle cell gene. Hence, if you get into a marriage with someone with genotype AS, in each pregnancy, there's a 1 in 4 chance that that child will come down with sickle cell anemia. Now, there is really no excuse to bring people into the world to suffer this much. Many of them get depressed, many of them despair of life and want to commit suicide. They're basically in and out of the hospital. It's needles every day, and it's terrible. Pain they go through, the trauma they go through, it takes a lot of struggle for them to lead normal lives. Of course, there are things that we advise them to do to live their best lives, but it's still not the same. Now, same thing applies if you are genotype AC. The implication is that you should not get married to someone or get into a partnership with someone who is genotype AS or genotype AC, because you can have children that are either SS or SC. And remember, it's a 1 in 4 chance per pregnancy. The implication is that a wrong paired couple can have all children who have sickle cell disease. And they could have 1 out of 2, 2 out of 3, 3 out of 4. But you see, the issue is this: just one child with sickle cell disease is enough trouble. That child is going to go through a lot. You as parents will go through a lot caring for that child financially, emotionally, psychologically, because as much as Science is advancing and everything is being done to help these people lead as normal lives as possible. It is what it is. Sickle cell disease is not good for anybody. It's not something you want to experience because it's difficult for them to go through life. They have to do so much extra to lead lives as normal as you and I do. Now, we've had situations where people got married thinking, oh, my partner is AA and AS. And this brings me to the issue of genotype testing. Of course, there are different types of genotype testing. The common one that is out there, the liquid paper chromatography, sometimes in certain cases may come back with results that are not accurate. That happens sometimes. That's why it's important for you to get tested, not just in any lab. Get tested in reliable labs that know what they're doing. And if you have to get tested a second time in a separate lab, it's safe to do so, especially if your genotype is AS or AC or, of course, SS or SC or CC, because your decisions would matter as touching the children that you will bear. And rather than get into a relationship with someone whose genotype you don't know, and then at the point of wanting to get married or wanting to have children together, you find out that there is an issue with genotype matching, and then you are in a fix where you are dealing with, oh, I love him, I love her, I cannot do without him, I cannot do without her. You can save yourself this trouble by ensuring that people in your circle know their genotype. You don't have to be in any serious relationship to tease people around you, especially if you know your genotype is AS or AC. Tease friends. Do you know your genotype? Can we go and do a genotype testing such that if it turns out that it's someone in your circle, okay, that approaches you for a relationship that will result in the birth of a child, you already have foreknowledge, so to say, and you can decide what relationship will work and will not work. There are certain things people say about people who are genotype AA. They're very prone to malaria. Well, there's some truth to it, because those who have the sickle cell gene, their red blood cells are not that conducive for malaria parasites to multiply. However, this is not a reason for you to assume that your genotype is AA because you have malaria often. That is not a confirmatory test. Those with sickle cell disease can come down with malaria. Those with AC can come down with malaria. Those with AA can come down with malaria. So know your genotype. Get tested in a proper lab, and if you find out your genotype is AS or AC, ensure before you get into a partnership that will lead to the birth of a child that the other person's genotype is nothing but AA. Please let us put an end to sickle cell disease. Now, having said all this, what do people with sickle cell disease need from you? Firstly, they do not need stigma. Now, the word sicklers is actually supposed to be a medical term that was being used to describe what happens to the red blood cells of people with sickle cell disease, the fact that their red blood cells sickle. However, it's a word that has now gradually become associated with stigma, in that sicklers are considered as sicky, those that will die young, those that can't do a lot of things, and so on and so forth. And this stigma is not helpful at all. It takes a lot to be someone with sickle cell disease, hence stigma does not make it any better. Secondly, what don't they need from you? They don't need your pity. Pity is not going to do any good. Pity does not help anyone. You're feeling sorry for them and sounding like, hey, that doesn't help. Rather, what they need is true friends. People who are empathetic, people who recognize what they're going through and are willing to help them push through these difficult times. They need people who can be there for them at those times when they take ill. People who can be there for them when they are healthy and to help them stay healthy. People who will be there to lovingly tell them to get good rest. People who will be there to lovingly tell them to eat well. People who will be there to lovingly tell them to to reduce strenuous activity. People who will be there not to judge them, but support them through their decisions. They want to live as near to normal lives as possible. And it's important that you are not there watching over their shoulder, and every little thing they want to do, you are on their case. Rather, they need you to understand them. They need you to support them. They need you to give them all the emotional and physical support that is necessary. If they are students, then they need help because they need to study like every other student. So as a colleague to someone with sickle cell disease, how are you helping the person in terms of how the person studies, in terms of how the person rests and manages the stress of work, of lectures and exams? If the person is your co-worker, how do you help to ease their burden? I know you have a lot of work to do yourself as a student, as a worker, and so on and so forth, but you want to be there for them. They need your help. They need your love. Kudos to men and women out there who choose to love and get into marital relationship with people with sickle cell disease. You are wonderful. You are heroes, because it takes a lot for anyone to choose to look away from the disease itself, to look away from what people think about it and how they view these people, and choose to love them and have them for wife, have them for husband. Of course, a lot of caution needs to be taken when it comes to conception and all that, but still, it's huge kudos to those of you who choose to love people like this to the point of making them your spouse. Hi fellas, it's a common occurrence that we find children present to the hospital having accidentally ingested harmful substances. You have incidents where a child has maybe taken kerosene, perhaps hypo, and worse still, things like sniper and the likes. And what we find more often than not is that the major problem we actually deal with is the response of the parents or guardians to this accidental ingestion. Let's deal firstly with how in the first place did this child end up accidentally ingesting whatever it is, battery fluid and so on and so forth. Now, children, especially those who are crawling or have just started working, are very inquisitive and they are learning, and they tend to take anything and everything they find to their mouth. How much more when they are learning to drink from a cup or a bottle, when they see anything that looks familiar like a plastic container, an empty bottle, a cup, the tendency is that they grab and then they pour straight in their mouth. Now, that means that there's a lot of responsibility on us as parents, as guardians, to ensure that we protect our children from things like this. That means we need to consciously keep things like this out of the reach of the children. You have no business putting something like hypo or kerosene and the likes in your regular drinking bottles, like empty bottles of, like we say, bottled water or this soda, fizzy drinks. You have no reason to put those things in those bottles, because the chances are that your child unknowingly would assume that the content is water. Even keep them in such bottles, which you should avoid. You should keep them totally out of reach of the children. That's the first thing. Your responsibility, my responsibility, to keep them from having access to these harmful things in the first place. Now, the second thing is, when these children mistakenly take these things and they drink, more often than not, it's not pleasant in the mouth. For some of them, it's very irritating, it burns their mouth. For some, it's the taste or the smell that puts the child off. So more commonly, they do not ingest much of it. Hence, your attempt to get them to throw up and all that sometimes could do more harm than good. In my part of the world, palm oil appears to be a solution to everything. So you have a child like that who has mistakenly ingested kerosene or hypo or whatever it is, and then they start to pour palm oil down the child's throat. Now, what happens more often than not, which we see, is that they aspirate the palm oil
Or while throwing up, the contents of their stomach, including whatever it is that they took, now goes into their airway, into their lungs, causing what we call aspiration pneumonitis. You have a child who ingested maybe just a little negligible quantity of whatever it is, and then in the bid to induce vomiting, you have now caused a more serious problem. So oftentimes you see them present with fast, difficult breathing, and then the story is that, oh, I actually drank this or that. What should you do if you find out that your child under your care, a neighbor's child, has accidentally ingested something? You need to get the child to the nearest hospital as soon as possible. Trying to induce vomiting may not be very safe. It could be helpful, but may not be very safe. Most times, children who have ingested substantial amounts will likely vomit themselves or start to drool a lot, depending on how corrosive what it is they've taken is. The vomiting could be helpful, but if you're not careful, they vomit and then they aspirate, and then the problem is much worse. So the best thing is to get to the nearest hospital where health professionals know the next best step to take. For some cases, activated charcoal may be helpful. There are other cases where there are specific antidotes that can be given to help to neutralize the effect of the poisons that the child has accidentally taken. So ensure you keep these harmful things out of the reach of children. Don't put them in cups, don't put them in transparent bottles, in things that a growing child will be familiar with as containing water. Keep them out of reach, and then if by any chance it has happened, don't panic. Yes, it's natural to be scared, to be worried, but your panic is often what does more harm to the child.
Hello, fellas. Now, what should you do and what shouldn't you do when you see someone having a convulsion? Start by telling you what a convulsion is. Basically, it has to do with abnormal electrical activity going on in the brain. Basically, our body is run on its own kind of electricity. The brain sends signals to different parts of the body to carry out different actions. So as I'm speaking to you, there is transmission between my brain, my muscles of my mouth, my body. That's why I'm gesticulating and talking the way I'm doing. Now, when you have, just like what you will have when in my part of the world, sometimes there is a power surge, and then you have, as we say, a transformer blow. You get it, and you're having sparks all over the place. Now imagine that happening in the brain. That happens in the brain, and then it sends signals to different parts of the body, which results in those different activities we see, the common one being the convulsion that we are all familiar with. Now, what should I not do when I see someone convulsing? Don't run away from the person. It's not contagious, okay? There is nothing about epilepsy or most illnesses that result in convulsions that are contagious. So you need not run away from the person. Rather, this person needs your help. What else shouldn't you do? Well, in my part of the world, part of the things people do is put the leg of the child in the fire. Well, the most common first thing that people will do is take something like a spoon or whatever and force it into their mouth, supposedly to prevent them from biting their tongue. Now, this is absolutely not necessarily, will probably do more harm than good, because you might just dislodge the teeth, you might cause a lot of injury in the mouth, you might send something flying down the breathing pathway and choke the person. So what should I do if someone near me starts convulsing? The first thing is to look around. Before you run to the person, look around. Identify that the area is safe. It's not that the person is convulsing as a result of maybe exposure to maybe a power source or something. Ensure there is nothing dangerous that will be of harm, firstly to you, and then secondarily to the patient. The next thing will be to, if necessary, move the person away from anything harmful, from any location harmful. And this is something you have to do carefully, especially if the person is jerking uncontrollably. You most definitely will need help. You want to put the person lying on the left side. Try to keep the person a bit steady. For most situations where people have convulsions, it will self-abort, meaning it will stop on its own. Less than 5 minutes, maybe more, depending on what exactly is going on. So how things pan out will determine what your next action will be. But the first thing is make sure the person is safe. Put the person lying on the left side of the body, sure that if the person throws up or secretions that are coming from the mouth are not aspirated into the airway, choking the person. So they want to wait it out. However, during that period, get medical help. If the convulsions persist and are not stopping in 5 minutes or so, you want to find a way to support the person and get the person to the nearest hospital. Hi there. So, have you ever seen someone just suddenly collapse next to you and you're not sure exactly what has happened? The person has just passed out. Now, it's important to know that there are different reasons why someone can just suddenly pass out. It could be from a low blood sugar, if the environment is very hot, from a heat stroke, claustrophobia. There are a million and one things, but more serious things can happen, like, you have what the layman will call a heart attack. Okay. It could have been, a stroke. Okay. Just using layman terms, basically. Any of those things could have happened. Now, you are beside the person. What should you not do and what should you do? Now, the first thing, as always, is to identify, is the scene safe? That is this person surrounding safe? Has this person passed out, maybe haven't come in contact with, a power source or something, from electric shock or something, or you want to look, or this person has passed out right in the middle of the road, okay, where it's not safe for you to run at the person, lest you get involved in a road traffic accident or something. You want to ensure that the environment is safe. Then you can approach the patient. Now, what shouldn't you do? Please don't pour water or any fluid on the person. What you do is put the person initially lying, on their backs, if necessary, depending on how you met them. Tap the shoulders. You call out the person's name if you know the person's name. Now, if there's no response, you want to identify if this person is breathing. That's relatively easy to see whether there's any chest movement, abdominal movement to show the person is breathing. And then you want to check if the person's heart is beating. Now, to do this, commonly, it's easy to check central pulses. Central pulses will basically be what will guide you to know if the heart is beating or not. Checking a radial pulse might not be, the best thing to do in such situations. So to check the carotid pulse, okay, which is in the neck, which you probably would have seen people demonstrate in movies, you basically identify the midline of the neck and then gently slide your hand down to the side, either to the left or the right, or to the groove between the midline where you have the trachea, and then you move to the side. Just in that groove there is a muscle, the sternocleidomastoid, that is just behind. Now, if you just put your finger there for just a few seconds, you should be able to feel the carotid artery pulsating. If it's pulsating, that means the heart is beating. The person is breathing fine. So you probably will now need to just put the person lying on the left side while you try to get medical help. Don't do anything drastic. However, if you have any reason to believe this person is not breathing or the heart is not beating, the best you can do for starters is to start what we call chest-only compressions. If you don't want to do mouth to mouth, it's fine. It's understood. For an adult, a chest-only compression is enough to save the person's life if what the person has had is a heart attack, in which case you put the base of the heel of your palm interlock with the other, and then this goes on the center or lower part of the chest, okay, like that. You interlock and then you push hard and fast, and do that until you can get medical help or until you get a response from the patient. So if the patient collapses, don't pour cold water on them. Just tap the shoulders, try to get the person's attention. If there's no response, is the person breathing? Is the heart beating? Then that will determine your next steps.
Hello fellas. Now we find a number of children who have developmental delays and that they are unable to achieve what we refer to as developmental milestones at the expected times. Now there are several reasons why this can occur, but I would like to focus in this conversation on that which is due to events that occur around the delivery of these children. Now there is what we refer to as cerebral palsy, which results from injuries to the brain, which cause non-progressive problems with movement, posture, and tone. Now, for a large number of children who develop cerebral palsy, the insults to their brains occurred around delivery, either due to prolonged obstructed labor sometimes due to a refusal by intending parents to consent to having surgical delivery on different grounds, which could be cultural, religious, and the likes. Also, it could be due to the poor skill of those who are attending to the delivery in knowing what to do to help these babies breathe right after delivery. Now, my message in this post is to intending parents. Please book for antenatal care as soon as you find out that you are pregnant, and do so at a reliable, reputable hospital, whether in public or the private sector, depending on your financial capacity. However, we strongly advise that first-time mothers book at government hospitals for obvious reasons. Now, the purpose of booking early for antenatal care is such that your pregnancy can be properly monitored, and certain problems can either be foreseen and they can be addressed before they come up, or just as they do, and this can occur either before delivery or during delivery. Now, while there are traditional birth attendants out there who are fairly trained on what to do in taking deliveries and also know the right time to refer patients that they cannot handle to proper hospitals for best care, there are still out there a lot of quacks and greedy people. Some you will find even in some of these so-called private hospitals and maternity homes. And a lot of times the damage they do is irreparable. Now, a well-trained healthcare professional of whatever cadre knows when the situation before them is beyond what they can handle, and they know how best to refer to professionals who know exactly how to handle the situation. However, when you have these quacks, they often bite more than they can chew and leave these children with permanent injuries that they have to deal with all lifelong. Also, when a trained health professional advises you on the need for a surgical delivery, please heed their counsel. Put aside whatever views you might have, whether they're cultural or religious or otherwise. You won't be doing yourself or your baby any good. Again, as we stated here, having persons taking the delivery of the child who know how to help a newborn initiate breathing when they've not done so on themselves is crucial, not just to the child's survival, but to the child's meaningful survival, such that the child doesn't have to live with the effects of brain injury due to what we call asphyxia, which can occur during or around the birthing process. Now, we've heard repeated stories of babies born not breathing, and all manner of harmful and baseless practices carried out to help them breathe. These practices would include spanking the baby repeated times, turning the baby upside down, shaking them vigorously. And all these practices, not only are they harmful, they are not effective in getting the baby to breathe. And when the baby does breathe, a lot of valuable time during which the correct things can be done to help these babies has been lost. And more often than not, these babies are left with brain injury that will reflect as they grow up, leaving them as children who would require a lot of special care and may not be able to lead normal lives like their peers. We've had a discussion earlier on questionable newborn practices, especially as touching jaundice and how it can be harmful to the brain. So I would like to implore you, if you did not follow that video series, to go back and get informed on these questionable newborn practices and how jaundice itself also can be damaging to the brain and can result in cerebral palsy. So my appeal is simple: let the babies breathe. By making the right choices as touching how early you register for antenatal care, a kind of center where you register for such care, and very importantly, heeding the counsel of healthcare professionals, especially when they suggest surgical delivery, is very key to helping these babies breathe. Please, let the babies breathe. Hi fellas. A major challenge we find in dealing with children and adults with convulsion is the attitude and actions of caregivers and the public towards it. You find people running away from people who are convulsing, or doing things such as putting a spoon or some other objects into the mouth. And there are other practices such as putting onions in their eyes or their nose or their mouth. And worse still, some people go as far as putting the feet of a child convulsing into fire. Now, all these are harmful practices that stem from a lack of understanding of what convulsions are and what the steps to take in dealing with the situation are. So, let's take a small detour on what convulsions are, what not to do, and what to do when a child or someone around you has a convulsion. Now, let's start by addressing firstly the question, what are convulsions? Convulsions are physical, largely movement or posturing related manifestations of abnormal brain electrical activity. You see, the body runs on its own kind of electricity, with signals being sent from the brain to different parts of the body and back. For example, the reason why I can talk the way I do and gesticulate is because electrical signals being sent from and to my brain to cause this activity to happen. Now, just as you have with electrical systems, you can have a situation where there's a power surge and then you have electrical charges flying all over the place. This gives you an example of what it is like when a convulsion happens. Due to some events affecting the brain, which could be temporary, permanent, or progressive, the brain cells begin to misfire, and that results in abnormal jerking movement, foaming of the mouth, as you often find. Now, there are different reasons why convulsions could occur. In children, particularly under the age of 5, a febrile convulsion, which is convulsion due to very high body temperatures, can occur, especially when temperatures are as high as 38 degrees centigrade or more. This is commoner in boys and it often happens in families. And the best way to prevent it happening will be to prevent the child developing a fever in the first place, or attending promptly to a fever in this child, either by giving antipyretics such as paracetamol and then tepid sponging. And then next will be to immediately ensure that we identify the cause of this fever and treat it appropriately. Also, convulsions in children could be due to low blood glucose, especially in newborn babies and babies less than 4 weeks of age. Convulsions could also occur due to infections, either of the covering of the brain or the brain tissue itself, such as in the situation where you have meningitis. You could also have convulsions due to some baseline brain abnormalities, which could be genetic, could be due to asphyxia, and could also be due to damage to the brain due to severe neonatal jaundice. Convulsions can also occur due to trauma to the brain, which could be due to a fall or some other traumatic head injury. Having said all this, what should I do if I see a child or an adult convulsing? Firstly, don't run away from them. Your immediate help might be vital to their survival during this episode. The foaming at the mouth that we see during convulsions are largely due to excessive salivation and an inability to swallow at the time. And while you might not be able to tell for certain why this person or this child is convulsing, the likelihood that it is from a contagious infective source is not as much. Secondly, don't force anything into their mouths. In doing this, you likely will cause injury to their mouth. You could dislodge teeth, which could go and block their airway. You could push the tongue further back into the airway and it obstructs the airway and their ability to breathe. Thirdly, I think it's obvious that putting onions in the eyes or in the nose or in the mouth, or worse still, putting the feet of the child in fire is of no benefit in taking care of convulsions. So, what should you do if you find someone around you convulsing? The first thing you want to do is ensure that the area where the person is safe. Ensure that there is nothing harmful, like, as we say, naked wire, or other things that could be harmful both to you and the person in the vicinity. Now, as soon as you've been able to identify this and you can approach the patient, you want to immediately, if necessary, move them to a safer location and subsequently loosen their clothing and put them lying on their left side. This is what we refer to as the left lateral position. The purpose of putting them lying on this side is that if they vomit, which they often do during episodes like this, the secretions do not go into their airway and block it, causing them not to be able to breathe. Also is the fact that in loosening their clothing, you're making it easier for them to breathe, and you'll be able to tell in a child, particularly if the child is burning up. Now, for a child who has a fever, tepid sponging with lukewarm water might be helpful. Now, it's important to note that in most cases, convulsions will resolve on their own in less than 5 minutes. However, whether or not they do, the next thing to do will be to get that child or that person to the hospital to get checked out for proper diagnosing and treatment. And as much as possible, you want to do this while keeping them lying on their left side. So summarily, the meaningful survival of children or adults who convulse depends on your ability to take the right decisions in helping them get through the convulsion and getting them the needed medical help to prevent further harm. Bye.